At this conference, we have seen renewed commitment to attaining previously set goals, especially ending HIV and AIDS by 2030. Nigeria has more than 3 million people living with the virus and barely 20% of those on treatment. How far along is the country coming towards attaining these set goals, especially with donor fund drying up?
We are making progress, but one of the things that has held us back, we're not documenting enough.
We have not done as well as we could have done in terms of treatment. Now, the other area that we're really struggling with is mother-to-child transmission.
There had really been a significant impact because before now you don't get those target populations coming out, but right now we can reach them.
But there are still challenging issues. First, how many people in Nigeria are actually living with HIV?
Whichever of those surveys used in Nigeria give us a prevalence estimate of over 3%, closer to 3.5%.
If we look at all the programmatic data that we have, and we have tested tons and thousands of people, we are under 2%.
We have 60,000 kids born HIV positive in Nigeria every year. We have the largest burden.
The data you have is not very correct. In all the testings we have been doing, okay, both from NACA and the Ministry of Health and the National Primary Healthcare Development Agency in their maternal, newborn and child health clinics, which is now quarterly from 2, is much lower, all lower than 2%.
There's also the issue of research and development, which South Africa has taken quite far.
We also expect our governments to ensure increased investment in research and development.
I think government commitment to research and development is imperative, because if government leads, then the private sector would follow.
The ending of the U.S. Presidential Emergency Plan for AIDS Relief, PEPFAR, is quite worrying for many.
We're very worried because if PEPFAR leaves Nigeria, I wouldn't know. We're just going to go back to the same ditch we've been coming from.
So many people are not paying for their treatment, consumables, because American government has been withdrawing their funding, and Nigerian government as a government is not taking the ownership and responsibility, ownership and the sustainability.
Most of the PHIVs who are not able to pay, what they've resorted to do is to default, and some of them who can find somewhere to pay have also resorted in sharing the pills into PCCs to be able to measure up to the amount or number of times they would want it to stay.
Our political commitment must be stronger than this. There is some political commitment at the federal level, it must go up. But it's disappointing at state level and local government level.
This year's AIDS conference has ended, but work goes on behind the scenes. Hopefully Nigeria and the rest of the world will keep moving closer to achieving an AIDS-free generation soon. From Durban, South Africa, Betty Dibia, Channels Television News.